You're now looking at the midbrain, the uppermost segment of the brainstem, nestled between the diencephalon above and the pons below. It serves as a vital conduit for ascending sensory and descending motor pathways, houses key cranial nerve nuclei, and contains integrative centers for vision, hearing, and movement. Externally, the midbrain is divided into a dorsal tectum, a ventral basis pedunculi, and an intervening tegmentum. On the dorsal surface, the tectum presents four rounded elevations called the corpora quadrigemina. The superior colliculi lie above and function as the principal centers for visual reflexes and orienting the eyes and head toward visual stimuli. Just below them are the inferior colliculi, which relay auditory information and coordinate reflexive head turning in response to sounds. A thin, translucent sheet called the superior medullary velum stretches between the superior colliculi, forming the roof of the cerebral aqueduct. Ventrally, the basis pedunculi, cerebral peduncles, appear as two massive, columnar bundles of fibers flanking the midline. Each peduncle consists of an anterior crus cerebri, containing the corticospinal, corticobulbar, and corticopontine tracts and a posterior tegmental portion. Between the peduncles lies the interpeduncular fossa, a depression from which the oculomotor nerves, cranial nerve 3, emerge on each side. The pineal gland and habenula commissura lie just dorsal to this fossa, though these may be obscured on simple gross inspection. On the ventrolateral margins you can sometimes see the exit of the trochlear nerves, cranial nerve 4, the only cranial nerves to emerge dorsally before wrapping around to the ventral surface. Now let's take a virtual cross-section through the midbrain to view its internal organization, which is classically divided into four regions from dorsal to ventral: the tectum, ventricular region, tegmentum, and basis. The dorsal tectum houses the superior and inferior collicular nuclei we saw externally. Deep to each colliculus are intrinsic neuron clusters, important relay stations in the visual and auditory pathways. Anterior to the tectum lies the narrow cerebral aqueduct, surrounded by the periaqueductal gray. This gray matter region modulates pain pathways, coordinates defensive behaviors, and contributes to autonomic control. The tegmentum, forming the bulk of the midbrain's core, contains several critical nuclei and tracts. Medially you find the oculomotor nucleus, whose fibers exit ventrally to control most extraocular muscles, and just ventrolateral, the trochlear nucleus. Near the aqueduct is the Edinger-Westphal nucleus, providing parasympathetic input to the pupil and lens. Lateral to these lie the red nuclei, large, reddish-brown clusters involved in motor coordination via connections with the cerebellum and the substantia nigra, a darker band of pigmented cells critical for dopaminergic modulation of movement. Degeneration of this area underlies Parkinson's disease. Ascending sensory pathways cross here as well. The medial lemniscus, carrying fine touch and proprioception, arcs through the tegmentum on its way up to the thalamus. The spinothalamic tract runs anterolaterally, conveying pain and temperature. The medial longitudinal fasciculus courses near the midline, linking ocular motor nuclei for coordinated gaze. Descending, the corticospinal and corticobulbar fibers in the crus cerebri fan out through the basis, en route to their targets in the pons and spinal cord. Also embedded within the tegmentum is the reticular formation, regulating arousal and consciousness, and the trochlear nerve fascicles as they loop dorsally around the cerebral aqueduct before emerging. Blood supply to the midbrain comes primarily from branches of the posterior cerebral and superior cerebellar arteries. Lesions here can produce Weber's syndrome, ipsilateral oculomotor palsy with contralateral hemiparesis, Benedict's syndrome, oculomotor palsy with tremor and ataxia from red nucleus involvement, and Parinot's syndrome, upward gaze palsy from tectal lesions. In sum, the midbrain's external landmarks, colliculi, cerebral peduncles, nerve exits, and its internal nuclei and tracts together support vision, hearing, motor control, pain modulation, and arousal. Mastering these features will let you localize lesions precisely and appreciate how this small but mighty structure keeps the brainstem's highways and byways running smoothly.